Well, thank you for having me. And as mentioned, I'm the Director of Advocacy and Public Policy, and actually for the Central Texas Food Bank here in Austin. We cover 21 counties in Central Texas, and we are part of the greater network of food banks across the state feeding Texas, as well as the national food banks across the country feeding America. And the way we're structured is that every food bank is its own nonprofit, but we also work very collaboratively with our co-food banks on any kind of legislation that's coming before the legislature or Congress that would restrict food access. And so we look at any kind of legislation that we think would have any kind of impact on food access for our neediest populations. So I don't think you mentioned this, but Friday was the bill filing deadline in the legislature. And so there was a lot of stuff filed at the last minute on Friday. So I provided a list of food access bills. They're on the back table. I think they're posting it up online. These are the bills that I have been tracking. It is very possible that I've missed one or two that got filed on Friday. I hope not, but I'm going to go back and review, make sure I catch everything that was filed. Just a little background, food access legislation during the session usually involves some sort of effort to improve access. So that's by increasing location, making food more affordable, increasing the populations that are eligible for nutrition programs. And contrary to that, on the flip side, you also have legislation that is filed that could increase barriers for populations to get food access, affecting the funding that's available to our low-income residents. Most of the nutrition programs that we work with the food banks in the hunger community are federal, but there are some limited things that the state legislature can do at the state level to those federal programs. In some cases, they are required to get a waiver from the U.S. Department of Agriculture where these programs are administered, but in some cases, they do have a little bit of wiggle room here at the state level. I also put on here some of the key committees any kind of food access legislation is going to go through. House Appropriations and Senate Finance for sure. You'll see on the first bill on there, it has to do with the budget, but also the House Committee on Ag, the Senate Committee on Ag, Human Services, Health and Human Services, and then I put on here occasionally public education. So if we're talking about a food access bill that has to do with child nutrition programs, it might go to public ed. So on to the bills that we have on here. You heard us talk last time a little bit about the funding that the food banks are requesting an increase in. It's the Surplus Agricultural Grant Program. The good news is now that the House and the Senate versions of their budgets have been filed on the House side, they are increasing our funding to $10 million. So we are going to be working really closely to see if the Senate can up that amount and reach what the House is doing. This funding provides money to food banks to get surplus produce out to our customers. So it is produce that would normally be plowed under or not sold on the primary market, the seconds, the ugly produce, that is still nutritious and good for consumption. And that helps Texas farmers as well because that's produce that they're not losing money on. And that gets into the food banks when we distribute more produce out. It is a big effort among the food banks to not only distribute food, but distribute healthy food. At our food bank here in Austin, we have a goal in the next several years that 50% of what we put out in the community is produce. Because we know that people who have limited access to food also have limited access to healthy food, because a lot of times it's a financial issue. We also have on our list several bills that would relate to improving grocery store access in food deserts or low-income areas. This is a proposal that the Heart Association has been behind for the last several sessions. And there are these bills that are listed here, they vary a little bit in different ways, but generally the idea is to either establish a grocery store, full service grocery store that serves produce and healthy foods, or provide funding to revamp a grocery store or a corner store to make it more accessible for produce, like a produce container or something like that. So this is something that they are going to be pushing, and it, again, is providing investments for those type different stores and improvements. We also have on here some bills related to SNAP, that is the food stamp program. That is a program that we really track carefully with the food banks because we have so many of our clients that are eligible for SNAP. So one good bill is House Bill 1533. That would eliminate the asset test for SNAP. So right now in Texas, when you are trying to qualify for SNAP, they can count your assets against you, and that would decrease the amount of money that you get in your food stamp benefits. This would eliminate that and would put us in line with a lot of the other states in the union that have already eliminated this. So this is a bill that would eliminate the asset test for liquid assets as well as an auto. If we really want to see people get on their own feet and become sustainable in terms of their economic security, we don't want to dissuade them from saving money and having an auto that takes them back and forth to work and things like that. We also have several bills related to school food and school nutrition, and that is something that we work really closely with the food banks. A lot of us have programs in the schools, and we also are very concerned about child nutrition programs. Representative Giddings has filed a bill that sets a standard policy on how school districts handle unpaid school balances for lunch programs. So the policy is kind of all over the place in terms of how a school district handles that. And this generally affects the kids who are the reduced price kids, because if you're a paid kid, your parents are paying the school meal account. If you're a free kid, you're not having to pay anything. So it's generally the reduced price kids that run up these balances a lot of times. And depending on the school district, they may allow them to charge out for a while. In some cases, they completely cut them off of getting a meal. So this would give a grace period and allow the kids in those families to not only be reviewed to see if maybe they're eligible for free meals, but also it would allow a grace period for them to charge out that balance and work with the families a little bit better. And we think that's really important for those kids who are facing that issue. We also have bills on here related to, I have on here SHAC, and that stands for School Health Advisory Council. And we have a bill that is related to marketing at school districts, and that's something that SHAC's, a School Health Advisory Council is a council that is appointed by the school board. Every school district in the state is supposed to have one, but they look at everything from physical activity and nutrition education to school immunizations. All of those things kind of fall under the SHAC to make recommendations to the school board on. There is a bill that requires them to review the policy related to food marketing in a school district. Obviously, we have a lot of school districts that have sugar-sweetened beverages and other kinds of food marketed at the school district. And when we're sending a message out to our kids to eat healthy and we have that marketing going on, this would let the SHAC review that and see what's appropriate. We also have a study creating a statewide study on access to healthy foods. So that is a bill by Rodriguez, and that is looking at making sure that we know where healthy foods are, where there are gaps, where we need support, that sort of thing. So on to my bills of concern, and I said of concern because every bill can be amended. So these are bills that, obviously, if they move, we're going to be working with the authors to try and make them better and make them a little more palatable. So several of the bills are creating barriers to SNAP recipients on their benefits. As I mentioned, that's a lot of what that legislation tends to do, is they tend to put some sort of barrier in place for the eligible population. When we require an ID to use a Lone Star card. So a Lone Star card is the card that your SNAP benefits get loaded on. So you might have seen people checking out at the grocery store and they have this card. That card has benefits for a household. So if you are requiring an ID to use a Lone Star card, that creates a lot of issues. Say the grandson is going to the grocery store for grandma or something like that when they're issued by household. We also have a similar bill requiring a photo on a Lone Star card. This would be the same situation where you have benefits are issued by household, but then you have a barrier created in terms of what a family has to do to get those benefits. We also have, how much time do I have? A few minutes? I don't want to go over. We also have bills requiring waiving work exemptions for SNAP recipients. So right now, under the legislation for SNAP, if you live in an area that has a high unemployment rate, you can often get a waiver from the work requirements. Normally, if you're getting SNAP benefits, you have to be working or you have to be in a work program with the Workforce Commission. And this would really cut back on those exemptions. And right now, while the economy is good and we have really low unemployment, that's not as much of an issue, but we saw a lot of this being enacted during the last recession, where we had high unemployment. People were saying, I'm trying to get a job, but I just can't, there's nothing out there. We also have several bills that would either cut back or make it not mandatory for certain provisions for school districts. We have had a lot of focus on the school breakfast program in the last several sessions, because we know that this is a program that is underutilized, and we know the effect on kids when they don't eat breakfast in the morning. So this bill would make participation in the school breakfast program optional for school districts. Right now, by state law, if school districts have 10% or more free and reduced price eligible kids, they have to serve breakfast. And in addition, if they have 80% or more free and reduced price kids at a campus, they have to serve that breakfast for free. And those are two good things that passed in the last couple of sessions. This would make all of that optional for a school district. And I did talk to my friend who works with the school district community and the administrators, and she said, that's not our bill. So I'm not sure exactly where this bill's coming from, but that's very concerning. I don't know that a lot of school districts would take advantage of it, but if push comes to shove, there might be a situation where they would. Also, school health advisory councils, again, there's a bill making those optional, and we believe that those are really a key thing to student health. I happen to chair the Austin ISD School Health Advisory Council, and I can tell you that the things that we look at are very critical supports for students, everything from mental health to nutrition to healthy food access, anything like that. You'll also see on here a couple of bills related to prohibiting the types of foods you can buy with your SNAP benefits. This is an issue that gets talked about every time that SNAP is talked about. The Farm Bill is starting at the federal level in this next year, and that bill actually reauthorizes the SNAP program. Right now, you can buy pretty much any kind of food with your SNAP benefits. You can't buy certain hot foods. You can't buy tobacco, alcohol, house goods, that kind of thing. But you can buy lean protein and produce, and you can buy hot Cheetos and Big Red. There's a lot of pros and cons to limiting the kinds of foods that people can buy with their SNAP benefits. Definitely we want people to eat healthier, but when you start limiting food, you start having to define, okay, what's a healthy food? And then the retailers have to revamp their systems at the retail checkout to make that determination. You also have to look at, is it our job to really limit what people can buy with their SNAP benefit? I mean, that is very big brotherly to start looking over people's shoulder and saying, okay, you can buy that, but you can't buy that. Some of the programs that do have, very hard and fast nutrition requirements on what kinds of foods that you can get with those programs, like school lunch or WIC, those are limited to a certain population, a very select population. So while we want people who are lower income to eat healthy, we have found that providing incentives to purchase healthy food has been a lot more beneficial and a lot more, it works a lot better than actually providing restrictions. So there's a couple of bills on there like that. And then the last one I pointed out is a bill creating a pilot program. And I said need more info on this one because it is looking at block granting and what would happen with that. And so, oh, I'm sorry, go back. There is a block granting bill. This one is Perry's bill, and this is a pilot program to look at eligibility for nutrition and other types of programs and what you would do to gain financial security. So this is looking at taking a family and helping them get access to different things and how that affects them and really kind of shepherding them through a process. This could be good and bad. This could really tell the state a lot of information about what happens to a family in poverty and all the barriers they face, or it could have some interesting recommendations come out of it. So this is a bill we're going to actually work with the senator and look at further. This was filed on Friday, I believe. So, but back to the block grant, as I mentioned, there is a bill under the good bills on block granting by Raymond, and it's looking at public assistance programs. If they're block granting, the money should still be spent on poverty programs. So I just wanted to point that one out because at the federal level, block granting is an issue that gets talked about a lot. Speaker Ryan has been in favor of that. And if you block granted SNAP and some of these nutrition programs, when they come to Texas, then it would really be at the state's discretion on how that money is spent. And so that's very concerning to all of us in the hunger community to ensure that that money is there for those programs and that we have it available to the population that needs it. Those are the main ones I have. If you have questions about any of the bills that I have on here, please don't hesitate to email me or call me. I'm happy to answer any questions that you'll have. Thank you.
Any questions?
Yes.
So it sounds like you're saying that studies have been done that show that it's better to encourage certain foods that are healthier than being food police.
Yes. In our opinion, definitely. And there have been some programs here locally in Austin. There's a $double program that the Sustainable Food Center has at the farmers markets where you get double the value of your produce benefit. And that is, shown to get people to buy more produce. We have looked at the possibility of implementing a similar program in like brick and mortar stores like HEBs here locally to see if it would work, because we know a lot of our clients are not buying necessarily all their food at a farmer's market. They're going to HEB and Walmart and that sort of thing. So we just think that those incentives and helping with nutrition education and distribution of produce and access to produce is a better way to go about than trying to limit what you can purchase with SNAP.
Any questions? If not, let's give a big warm thank you to Kathy.
Thank you.